My name is Ian Gargan. So started out my career as a psychologist and trained as a psychologist and forensic psychologist, trained both in Ireland, the Republic of Ireland, in England, America and Australia. Then went and trained as well as a surgeon and orthopedic surgeon. And I had and always have had a very keen interest in the relationship between mental and physical health. Whereas with mental health and treating the patient, it demands facilitation for internal change and takes a long time for that change to be facilitated. Whereas in physical health, especially in orthopedics, I could change a hip or a knee in an hour or two, and the person would be running a marathon in 6 months. So it would be very, very different. But key was that mental health drives physical health performance and vice versa. But all of that practice was driven by data, and it was evidence-based practice, and then also practice-based evidence and epidemiology. And through that, I developed a very keen interest in paradigm shifts and changes in community-wide based medicine, whereby I might train certain doctors, or I might treat certain patients, 10,000 patients in my lifetime, but I was far more interested in what was the wholesale change that might affect hundreds of thousands of people and be able to affect change in their own lives and optimize their health. And as a result of that, would have worked as a chief medical officer for a number of national services, for government services in the UK and in the Republic of Ireland, and then moved on to be CEO and medical management piece, especially now with the Private Healthcare Information Network, of which your viewers and listeners can see at PHIN.org.uk, that informs patients about how to make the best choice for their surgical intervention and medical health care across Great Britain and Northern Ireland. So I lead that organisation of very talented people who create and collect data from over hundreds, if not thousands, of sites across the UK, and then put reports together that are publicly shared for the government so that patients can make more informed choices about their care. And that's what PHIN do, that's what I'm passionate about, and that's what we're here to talk about today, but also along with mental health and how that informing choice and power and autonomy in the patient can affect their choices, but bolster and empower them and make their mental health strong when they're engaging in healthcare intervention. Good question. So main barrier is that people will often think about mental health as something very negative. So if I have something physically wrong with them, like a cold, a cough, flu, or a pain in my hip, I will go and see a doctor, or I will know from reading up what way I should best treat that, whether it be through exercise, yoga, medication, supplements, vitamins, etc. So it's not considered a negative thing. It's just it's a little bit of an obstacle to get in the way of optimizing my health. So that is probably the main problem with mental health. People automatically think of it as something negative when I'm talking about addressing my mental health. And I've worked with patients for almost 30 years now, 25 years, the way it's important to frame it. And I've seen that journey, Dipti, as you've talked about, where mental health wasn't talked about to now everyone's talking about it. All right. So it's about optimizing your health and optimizing your smartness. So over 75% of people or CEOs now in Silicon Valley, which is one of the major technological hubs in the world, are women. And when they were interviewed, over 95% of those women, when interviewed, said they spend a minimum of 10 hours a week where they concentrate on their mental health. So these are not just people who are the smartest people in the world, who are leading the most lucrative as well as influential companies in the world. They probably have families to manage as well, and all of that other things that female CEOs go through. And they are saying, in order for them to be successful, I have to optimize my mental health in order for me to be the smartest I can be, through mindfulness, meditation, cognition, exercise, diet, and socialization. They're the main ways to do it. So the main changes I've seen are people embracing it, but also the barrier to people succeeding with it is that they have a preconceived idea that it is something negative to talk about, or something that's taboo, or something that they shouldn't admit to having a challenge with, and not think of it as something like the rest of their health that they should optimize in order to make them the most productive and smart person. So the first thing to think of is very good point, and the first thing to think of is change. If you see a delta, so a delta or a change in the way in which you behave. So think about the main things that affect your mental health. One is cognition, so how you're thinking. One is sleep. One is exercise, diet, and then general mindfulness and socialization. One is how you socially integrate. So first of all, if you start thinking that there's change in your habits in a given week, if the habits change for more than a fortnight, if your sleep is affected, if you, for instance, sleep 8 hours a night and now you're only sleeping well for 4 hours a night, if you don't want to talk to people, so your social pattern changes, if you find that your mind is running away with things that you usually don't think about, and also your diet has changed, you're eating more, or your appetite's gone, you're eating less and you're not enjoying any food. If you're noticing any of those changes and they're taking place for more than a fortnight, then you need to be thinking that you might have a mental health challenge. So be important to understand what mental health challenge means. So mental health challenge can be anything from disruption to your sleep pattern right up to proper schizophrenia. Okay, so it's a massive spectrum. I've seen in my practice where you have someone say, I'm just feeling a bit low, Ian, I don't feel I'm in the same mood as I usually am, I don't really want to meet my friends. And that's one thing to think about. Two, I'm actually seeing and hearing things that aren't there, and that's a psychotic episode. So you can see the massive difference in that. Okay, they demand very, very different things to support them. Right. So but over 70% of the mental health challenges seen in the world, and that's 1 in 4 to 1 in 5 people, 1 in 4 now after COVID, was 1 in 5, is depression and anxiety. That's the most common one, right? And people often think that depression is very difficult to treat. It's not. So in over 80% of people who have anxiety, it becomes depression. And depression and anxiety can be treated in NICE guidelines, and National Institute of Care Excellence says that they can be treated in between 6 and 12 sessions of cognitive behavioral therapy, or any therapy that suits you. And so that's the most common presentation. And with anxiety, the signs to watch out for are feeling on edge, palpitations, a bit of breathlessness, thinking something bad's going to happen, generally not being able to concentrate for long periods of time, and poor sleep pattern. They're the main things to watch out for. And then when that becomes depression, you have decrease in mood, general pessimism, feeling that there's an impending doom, like something really bad is about to happen. Your mood is low. We get anhedonia. So Dipti, hedonism is where we really enjoy ourselves. We constantly enjoy ourselves, and we have good parties and we meet people and we're in a good mood. Anhedonia is the opposite to hedonism, and where you're trying to get to somewhere in the middle, and the balance is the hardest part to get to. So depression is when you feel those things. And then always think in terms of change, or that delta, against the parameters that I mentioned first. Always think of it in terms of, where's my sleep, where's my diet, where's my exercise, where's how I'm meeting people and socializing, and how is my mind working. If you look at each of those categories and you see there's a change in any of those, then and it's around 2 weeks, that's when you should engage in help, whether it's an app, whether it's actually an app to support one of those categories, or whether it's a mental health professional or someone that's assigned to taking care of that and giving you advice at work. So we're increasingly seeing employers take responsibility for this in the workplace, so that people, and that's not just because it's the right thing to do, that's a very smart thing to do for employers, because if we're in a better headspace, we make the people around us feel better and we're more productive at work. So I think so let's start with the positives. Always important to start with the positives. So social media allows us to integrate and to engage with other people. So when I talked about socialization earlier on, and socialization starts from when we're children. So when mothers have babies, they have increases or surges in their oxytocin levels, which help the good mood chemicals in serotonin and dopamine, right? So when we have higher serotonin and dopamine, then we feel much more robust and a better mood. When each of us, so an oxytocin, those levels in mums, that allows attachment with their babies, which increases identity, self-esteem, and attachment, anything to do with psychology of attachment during our lives. So you can see how that's incredibly important for our development as human beings. So when we're humans later on, both men and women, when we engage with people and socialize, we get an increase in oxytocin, a surge in that chemical, and that biochemical then, just like it did with mum, it provides good mood chemicals. So when we engage on social media, we have a rise in oxytocin, and we feel connected, and that's really important. That's a positive. Okay, the difference with the negatives are that we become we get features potentially of obsessive compulsive disorder or habituation, where we become addicted to the feedback, where we can't disengage and we can't take time off to be centered and to have a life experience where we're either engaging in an piece of exercise or a piece of work that it's real life, it's tangible, it's touchable, we can smell it, we can see non-verbal communication as well as verbal. That's the negative, where we become too obsessed with feedback, too addicted to the feedback that we're getting and to the stimulation we're getting, and we're not getting enough real world influence. So the positives are the engagement and also the feeling like part of a community, and the negatives is where, like anything, we're too engaged and we don't take a break from it and don't and it goes with it saying there can be very negative. If I was on someone's shoulder all day telling them that they're not good enough and that they're not being as productive enough or they're not good enough a person, that would eventually get that person down, make them feel very low. And if I was on their other shoulder telling them all day they're an amazing person, they're really capable, they're intellectually robust, they can integrate and interact really well, they'd start feeling really brilliant about themselves and feeling really positive. The same happens with social media. If you're following negative role models and leaders who are making you feel bad about yourself, that will be very damaging to your mental health. So you need to be aware of not engaging with that type of toxic influence on social media. That can be a very negative impact. So I think they're the main positive and negative impacts of social media that I would address first. So I even see with our work at PHIN.org.uk, we're starting to use machine learning and AI to understand patterns of behavior that influence patient choice. So that's the same with mental health. So I would see if we're looking at data in medicine and AI using its expertise to train and attribute the right data to the person that needs it, and it affecting people's choice. And you've got to remember, choice and empowerment makes you feel mentally healthy and more robust. We see the same in specific and mental health treatment. So AI has been used, for instance, to effectively match the right patient to the right therapist, for instance. That's an example of how AI has been better used. So if I'm a therapist that's much better at talking about bereavement or grief, but I mightn't be as strong in dealing with patients who have addiction history, then, or sleep challenges, then AI is picking up the particular type of approaches to therapy, qualifications, and even just communication style of therapists to properly match them to patients. So I see it having a massive influence in the future. I also see even now how remote patient monitoring, like with our watches and Alexa at home and various other home monitoring systems can start to pick up our habits and our ways of communicating, which would also affect what way we can be attributed to our given mental health resources. So yeah, I think in the next months, years, 5-10 years, it's not a long-term plan, we will see huge change as a result of AI and how it helps with patient choice and mental health vision. So mental health and what mental health means to different cultures varies throughout the world. So take it, and I presented, and I've been fortunate enough to either train or go to conferences or to listen, and that's really, I think there's one thing that's the same in any culture, Dipti, that's really important: active listening. So, you know, if we can discipline ourselves to stop talking, which, as you can see, that's difficult for me because I love to talk. So if we can discipline ourselves to not talk for a few minutes and just to actively listen, that's where we learn the most. And that's probably the best thing you can do to help mental health. And that's probably the one thing that I've seen all over the world that's the same. So if we sit and listen actively and we're in the moment and paying attention, then that's the same throughout all cultures. That's really valued. That's a very smart thing to do. Okay, and that's a very good human trait, by the way. So but differences in cultures, yes. So I would see in the for instance, when I've been talking and listening to Japanese and to Chinese and to other Asian or Eastern cultures, they're very reluctant to open up and to show vulnerability. So they don't want to talk about, their mental health. And even with the sub-Saharan, and African also cultures, I've seen differences in that there's an awful lot of stoicism and feeling strong and exhibiting strength, and that's very synonymous with physical strength and mental strength. So again, showing that there's a mental fallibility is something that, or vulnerability, makes you perceive or think that other people perceive you as weak. Then in even in European culture, there is an awful lot of quietness, and there's a lot of respect given to people being able to take care of their own problems. So if you're not able to address your own mental health problem, then you're not seen to have those kind of resources, and we see that that affects the mental health. And you see differences in massive peaks in suicidal rates, especially in the Scandinavian countries. Okay, and also because of environmental factors like weather and darkness, we know that that's a factor. And then with the American culture and very westernized culture, even more Western than Western Europe, we see an openness to mental health and to talk about it, but maybe not to engage or address it enough in that culture, like whereby it's good to chat about it, but then do you actually do something about it in your private life? So more open to naming mental health as a challenge, but I question whether people engage enough in exercises, which takes energy. It takes people, it makes effort. This is work, right? Like anything, if you want to become fit to run a race, you need to train and to run. If you want to be fit mentally, you need to practice mindfulness and cognition and all of the other things we've talked about on this podcast. So like that work, I see the lack of engagement in the work in the Western culture. So there's massive differences in the cultures and how they approach it. Environmental factors, and just be aware of that as well, and people should be aware of that. What's in the internal factor and potentially what's the external factors? So sometimes it's not something necessarily, and I would argue there's nothing wrong with you, there's just a challenge for you. But think of it as well, is it an internal factor? Like, is it common in my family that people have had depression? That's fine. It's very common that we have in family heart problems or coronary challenges, so it's no different. The research would say, epidemiology would say, if it's genetic, then you're more leaning towards it. That doesn't mean you're going to have it, that just means you're more vulnerable to it, so address it. And that's an internal factor. And then the external factors, like you say, rainy, dark weather, and where we can't go outside, engage with nature, or we're not in the sunshine and getting the vitamins we need, that may be a factor in influencing your mental health also. So the Private Healthcare Information Network, PHIN, PHIN.org.uk, is a government mandated organisation that was set up 14 years ago by the Competitions and Market Authority, but it's supported and led by all the private healthcare and hospital groups in Great Britain and Northern Ireland. And what it does is provides all of data to one repository, that is PHIN, and the patients and anyone listening to us today can see all that data that's reported in a very accessible, you talked about accessibility, completely accurate, very accessible way on our website, that allows patients to see what particular operations surgeons do, what particular interventions doctors are expertise in, what hospitals carry out what particular procedures, then the outcomes of those procedures and the cost of those procedures, as well as then associated morbidities or mortalities or other data with them. So it gives a whole picture of that journey for a patient, so that the patient can decide where they think the best place or what doctor is the best person to choose to have the medical care that they need. So it's almost like a consumer educational mechanism, so patients can feel confident about where they can go to get the help they need. And we were set up, like I say, 14 years ago, but we've become very advanced in the last 3 and 4 years. And we provide all that information. We're a not-for-profit organization, so all our information is completely objective. It's not from a commercially driven place, so that patients can feel empowered and educated about where to go and get the help that they need. accessibility and customer journey. I've always thought as patients as customers who should have the best service like they do when they're purchasing a product. I see the innovations will be accessibility in the home place, where you'll not need to leave the home in order for you to have mental health support. I also see there will be genetic screening. That innovation will help. So we'll see medical and paramedical innovation, as well as customer accessibility with more easy to use products like apps and remote patient monitoring that will address the categories that we've already talked about that underpin mental health. So those innovations, as well as then bespoke tailoring of talk therapy to individuals, so that it's very sensitive to their own needs in life. So what your habits are, what your shopping habits are, what your work habits are, generally what way you engage with the community, and what country you're in, what culture. Like a lot of the influences and variables that we've talked about today, Dipti, will be addressed by innovative change that bespokes the approach to mental health to make it unique to you or me, because we're all completely different. And I think that's probably the most exciting innovation that I've seen as a doctor and psychologist happening and emerging now, whereby the package that's designed will be very much individually driven. That's probably the thing we should be most excited about over the forthcoming years. I would say the fact that it's actually going to inform the design of a new product that's useful, and the fact that you're maybe getting involved in a noble cause, that it was useful to something to you as a consumer, but generally that you're helping out your colleagues, but also your community at large, that you're contributing to information that wouldn't be abused, but that it would be information that would be used safely, that's generally very applicable to the wider population, so that you felt that you were empowered to create or supporting that change in the community. That's probably something that I think people it really resonates when you want to get involved in market research. So anything that would to look at the patterns of diet, sleep and exercise. I think they're key to mental health. We all want to integrate and talk with people and communicate. I think we're social animals. Mindfulness and teaching engagement about mindfulness is important. Like I said, I believe like cognition and therapy is really important. I think everyone should have a therapist and should talk to someone or talk with an app or something every week. But I would say that research on that and analytics in terms of behavior to be able to build better supports in sleep, exercise and diet would be key to the success of that research. No, I just would like to be useful to understand and to hear any feedback. Do you think there's a way in which we can get feedback of what's been meaningful today from your listeners and viewers, so that we can also improve our service at PHIN.org, but also inform our general medical knowledge? Fantastic. Yeah, well, as long as we can help at all, and any other information you'd like from us, Dipti, we'd be delighted to provide with you. So thank you for the opportunity.